Hello and welcome to the next video in our workers' compensation series. You can make a difference in workers' compensation injuries by providing an associate employee an experience immediately after an accident happens. One point of control you have when a workplace accident occurs is making sure an associate employee is assessed for their injuries immediately. This can be accomplished by using the 24/7 nurse reporting line. It can be very beneficial not only for QPS, but the employee who may not be sure if they need to seek medical treatment or how to treat for a minor injury outside of a medical clinic. Our nurse line needs to be contacted immediately for any non-emergency injuries. If you have advised an associate employee to contact the nurse line, please document that in Aviante and let your work comp specialist know right away.
All associate employees should be given the nurse line information on a wallet-sized card at the time of placement. All clients should be given a nurse line poster. All offices should use the phone checklist when the initial injury call comes to the office. These all contain the nurse line phone number. These all can be reordered through the marketing website. In emergency situations, do not call the nurse line. Allow your client or associate employee to determine if it is an emergency situation needing an ambulance to be called or immediate transportation to a hospital. The nurse line has three main functions: taking the report of the incident, triaging the medical situation, and steering or directing to a preferred provider. Taking the report of incident includes gathering associate employee demographics and accident facts. This is important as it is reported immediately after the call to Gallagher Bassett. Speed matters. Studies show the quicker an incident is reported, the less costly they are. The nurse line makes a medical triage suggestion, which means they will assess the degree of the injury and suggest if it is needed medical attention at a clinic or if self-care is appropriate.
Our nurse line uses a network of medical providers to determine the best clinic to direct or soft channel to. We have lists of preferred providers for many branch offices that the nurse line uses. If there is not a nearby provider, the nurse will use the zip code of the associate employee or the client company. The nurse line gives a reminder when a post-accident drug test is necessary within our policy. All of these clinics listed in our PPO network should work in conjunction with our compliance department, meaning they are already aware of our post-accident drug screen protocol. Telemedicine is becoming more prevalent in workers' compensation. The nurse line does have a telemedicine feature. It is only used if it is feasible and agreeable to the associate employee. What do you do if an associate employee or client contacts you to advise you of an accident and the associate has already gone for medical treatment? Contact your work comp specialist immediately with the details of the accident. The nurse line may not need to be called. However, you will need to follow up with the associate employee and client and document why the nurse line was not used and advised to use in the future. What do you do if you are advised of an issue with a nurse line call? Let your work comp specialist know. All conversations are recorded and we can have it investigated for learning. In the next video, we will talk about timely reporting. Use of the nurse line can also help your timely reporting. Stay tuned for more in the next video.